Well, for a family having trouble conceiving, having a baby can be an unquenchable thirst. And Dr. Cecil Long is here now. He's part of the American Institute of Reproductive Medicine, a new practice, and here to talk about options for you and your mate if you're having trouble conceiving. Thank you for being here with us.
Thank you.
And I think the first question certainly is, when should a couple come see someone like you for help with infertility or fertility?
The old rule was after a year of trying to seek help for fertility, but nowadays, as couples have put off having a child, it's probably better if you try for say 6 months or so and you're unable to be successful, to then start seeking help. You don't want to wait too long.
Right.
You don't want that window to escape you.
And then age has something to do with it, wouldn't you say?
Absolutely, absolutely. Again, you know, we're delaying having children, and so a lot of elements in the world start to catch up with you. And women who have a limited number of eggs that they are born with can start having a decreased availability of good eggs. So usually age 35 is kind of a critical age that you want to try to get things started before or after or immediately after age 35. You don't want to let time catch up with you and cause you not to be able to have your baby.
And what would you say are the major causes of infertility?
Well, there's 3 categories. Ovulatory problems. Sometimes this can be just as simple as a glitch in the communication between the brain and the ovary to release the egg on time. There are real easy fixes to that. Oral medications sometimes can help nudge the maturation process. Then there's anatomical problems in the reproductive tract. This can be endometriosis, it can be fibroids, it can be obstruction, mechanical obstruction to actual the tube picking up the egg, and probably about 40 to 50% of the couples we see, there is a severe male factor.
And that was my next thing. You know, of course, the woman is going to get testing, and your husband, your mate, should get that done too, the testing.
It should be done simultaneously, because what you hate to do is to start treatment on the wife only to find out later on that there may be a sperm issue, and then you have to go back and do maybe more advanced therapy.
And then wrapping up here, how expensive are those fertility treatments?
Well, you know, it's kind of a misconception. Most times we can just make minor adjustments. So very inexpensive. A lot of times insurance will help to cover these things. Very seldom do we really have to go all the way to in vitro fertilization or the more advanced treatments.
Okay, so there are options in between.
Oh,
there.
definitely, definitely. And I would urge couples that, you know, again, if they've tried for about 6 months and been unsuccessful, to seek help, because there's easy little fixes we can manage.
And you won't know until you see a guy like this. Thank you so much. And
Well, I appreciate it.
Yeah, we'll be right back.
Thank you.